The left coronary artery originates from the left aortic sinus and proceeds between the pulmonary trunk and the left auricle before entering the coronary sulcus. Shortly after its origin, the artery most commonly divides into its two main branches, the anterior interventricular artery and the circumflex artery, and feeds blood to the left side of the heart. The anterior interventricular branch, or the anterior interventricular artery or left anterior descending artery, is the branch of the left coronary artery that extends obliquely towards the heart's apex. The first branch of the anterior interventricular artery, known as the conal branch of the anterior interventricular artery, is a small branch that supplies blood to the conus arteriosus, a part of the right ventricle of the heart. Following the course of the anterior interventricular artery, we can see that it sends branches toward the heart's anterior wall. These are known as the anterior ventricular branches of the anterior interventricular artery. Taking a look at the left side of the anterior interventricular artery, we can see that it gives off branches that advance diagonally along the left ventricle. These are known as the diagonal branches of the anterior interventricular artery and supply blood to this part of the left side of the heart. Some arteries originating from the anterior interventricular artery descend into the interventricular septum, which they primarily supply. These are known as the septal branches of the anterior interventricular artery and supply a significant portion of the wall, dividing the left and right ventricles of the heart, also known as the interventricular septum. If we look at the left coronary artery, we can see that it sends a branch towards the left portion of the coronary sulcus. This is known as the circumflex artery. This branch descends along the left portion of the coronary sulcus, curves around the heart, and gives branches that supply blood to the left atrium and the side and back of the left ventricle. In most cases, this artery ends before reaching the inferior interventricular sulcus. The branches of the circumflex artery that supply the atria with blood are known as the atrial branches. They extend towards the left atrium from the circumflex artery. The circumflex artery gives off a large branch that advances along the left margin of the heart. This branch is known as the left marginal branch of the circumflex artery, and it supplies blood to the lateral wall of the left ventricle. The circumflex artery gives a branch that descends to the inferior wall of the left ventricle, supplying it with blood. This is known as the inferior left ventricular branch of the circumflex artery. This concludes our discussion about the left coronary artery.